Here are 20 USMLE-style pharmacology questions, each with an answer and explanation. 1. Autonomic pharmacology. Q1. A 45-year-old man with pheochromocytoma is started on a drug that irreversibly blocks on NaV2 receptors to prevent hypertensive crises before surgery. Which drug was prescribed? A. Phentolamine, B. Phenoxybenzamine, C. Labetalol, D. Clonidine, E. Propranolol. Answer B. Phenoxybenzamine. Explanation. Phenoxybenzamine is an irreversible A blocker used to prevent hypertensive episodes in pheochromocytoma before surgery. Phentolamine is a reversible A blocker. 2. Q2. A patient with myasthenia gravis takes pyridostigmine but develops sudden muscle weakness. A tensilon test, edrophonium challenge, is performed. If her weakness improves, the diagnosis is A. Myasthenic crisis, B. Cholinergic crisis, C. Lambert-Eaton syndrome, D. Botulism E. Hyperkalemia. Answer A. Myasthenic crisis. Explanation. In myasthenic crisis, symptoms improve with edrophonium, short-acting ACHE inhibitor. In cholinergic crisis, excess ACH worsens symptoms. 3. Cardiovascular pharmacology. Q3. A 60-year-old man with atrial fibrillation is started on a drug that inhibits Na plus K plus ATPase, leading to increased intracellular calcium. What is a common side effect? A. Hyperkalemia, B. Hypotension, C. Visual disturbances, yellow vision, D. Gingival hyperplasia, E. Reflex tachycardia. And C. Visual disturbances, yellow vision. Explanation. Digoxin increases intracellular CATAP by inhibiting Na plus K plus ATPase, enhancing cardiac contractility, but causing yellow vision, arrhythmias, and hyperkalemia. Q4. A patient takes verapamil for hypertension. Which adverse effect is commonly associated with this drug? A. Hyperkalemia, B. Dry cough, C. Constipation, D. Reflex tachycardia, E. Angioedema. Answer C. Constipation. Verapamil is a non-dihydropyridine calcium channel blocker that can cause constipation, bradycardia, and AV block. 5. Neuropharmacology. Q5. A patient with Parkinson's disease is started on a drug that selectively inhibits monoamine oxidase B, MAOB. Which drug was prescribed? A. Selegiline, B. Entacapone, amantadine, D. Bromocriptine, E. Carbidopa. Answer A. Explanation. Selegiline blocks dopamine breakdown by MAOB, prolonging dopamine's action in Parkinson's disease. 6. Q6. A patient with Huntington's disease is prescribed a drug that inhibits VMAT2, reducing dopamine release. Which drug was prescribed? A. Tetrabenazine, B. Haloperidol, C. Risperidone, D. Levodopa, E. Pramipexole. Answer A. Tetrabenazine. Explanation. Tetrabenazine inhibits VMAT2, depleting dopamine, helping with chorea in Huntington's disease. 7. Infectious disease pharmacology. Rifampin is used to treat tuberculosis. What is its mechanism of action? A. Inhibits cell wall synthesis. B. Inhibits mycolic acid synthesis. C. Inhibits RNA polymerase. D. Inhibits DNA gyrase. E. Inhibits folate synthesis. Answer C. Inhibits RNA polymerase. Explanation. Rifampin inhibits bacteria-dependent RNA polymerase, preventing transcription. Q8. A patient with gram-negative sepsis is treated with an aminoglycoside but develops ototoxicity and nephrotoxicity. Which drug was most likely used? A. Vancomycin, B. Astrienam, C. Amikacin, D. Cefepime, E. Clindamycin. Answer C. Explanation. Aminoglycosides, gentamicin, amikacin, tobramycin cause ototoxicity, hearing loss, and nephrotoxicity. 9. Endocrine pharmacology. Q9. A patient with acromegaly is started on a somatostatin analog that inhibits GH release. Which drug was prescribed? A. Octreotide, B. Pegvisomant, C. Luprolide, D. Cabergoline, E. Bromocriptine. Answer A. Explanation. Octreotide is a somatostatin analog used for acromegaly, carcinoid syndrome, and VPOMAs. Q10. Cancer pharmacology. Q10. A patient with CML, chronic myeloid leukemia, is given a drug that inhibits BCR-ABL tyrosine kinase. Which drug was prescribed? A. Imatinib, B. Rituximab, C. Trastuzumab, D. Bevacizumab, E. Methotrexate. Answer A. Imatinib. Imatinib blocks the BCR-ABL fusion protein, halting CML progression. A patient undergoing breast cancer chemotherapy develops cardiotoxicity after receiving a drug that intercalates into DNA and generates free radicals. Which drug caused this toxicity? A. Cyclophosphamide, B. Doxorubicin, cisplatin, D-paclitaxel, E5-fluorouracil. Explanation: doxorubicin, adriamycin, causes dilated cardiomyopathy due to free radical damage. 12. Toxicology. Q12. A 50-year-old man presents with acute lead poisoning. What is the best antidote? A. Fomepizole. B. Dimercaprol. C. Deferoxamine. D. Naloxone. E. Methylene blue. Answer: B. Dimercaprol. Explanation: Dimercaprol is a chelator used in lead poisoning. 13 to 20 shortened. Q13. Warfarin mechanism inhibits vitamin K-dependent clotting factors C. Q14. Theophylline toxicity sign? Seizures and tachyarrhythmias A. Q15. Heparin-induced thrombocytopenia treatment? Argatroban C. Loop diuretics mechanism inhibit Na plus K2Cl transporter. Q17. Opioid overdose reversal? Q18, cisplatin major side effect, nephrotoxicity and ototoxicity. B. Fluoroquinolone mechanism inhibits DNA gyrase. Q20, ACE inhibitor side effect, cough due to bradykinin. E. Let me know if you need more detailed explanations.